How's it going, guys? Pass level question neuro for step one. Actually, no, this is I'd say it's a medium difficulty question because of the anatomy component. Okay, but obviously the diagnosis is pass level for basically step one. All right, so a 14-year-old boy, he fell off his bike while BMXing. This is trick biking. Okay, direct branch of which of the following is most likely the source of the bleeding in this patient. So our pass level diagnosis for starters is going to be epidural hematoma. Obviously, we have our biconvex lens shaped bleed here. All right, so we're going to have a lucid interval. That's classic as well versus subdural where there's no lucid interval. We have a crescent shaped bleed. So let's just hop through the answers here. Choice A, external carotid artery. Correct answer. So the common carotid bifurcates into internal external carotid. The external carotid branches off into the superficial temporal artery and the middle meningeal artery. So the middle meningeal artery, of course, is our source of bleeding for epidural hematoma. All right, that made it more difficult. So middle meningeal artery is the source of the bleeding. Get a biconvex lens, lucid interval, and our external carotid, superficial temporal, middle meningeal. So let's just hop to the others here. Internal carotid, wrong fucking answer. It's going to go to our circle of Willis. So obviously many vessels coming off, but this would be for our strokes. All right, so the common carotid plaque is going to launch off to the internal carotid, and then that can go to the retinal vessels. It can go to the MCA, the ACA, different types of stroke. Wrong fucking answer. Choice C, posterior communicating artery, wrong fucking answer. It's obviously our subarachnoid hemorrhage, okay? It could be ACOM or PCOM aneurysm, and hypertension is the most important risk factor. Things like ADPKD, Ehlers-Danlos obviously can cause saccular/Barry aneurysms as well, but hypertension most common cause. And something special about PCOM aneurysm you need to know for USMLE is that it causes an ipsilateral blown pupil, ipsilateral mydriasis. So it's probably shown up in questions. You probably didn't even realize it. If you've seen it, now you'll notice it. Okay, so if you get a big paragraph, not really sure what's going on, think maybe it's a subarachnoid hemorrhage, and you can get an ipsilateral blown pupil. Now, and that's due to compression of cranial nerve 3, okay, which is normally parasympathetic, which constricts the pupil. You also need to know another important factoid about subarachnoid hemorrhage is it can cause a stiff neck, meningismus, okay? So it's not meningitis. Some students get confused by that. You get a stiff neck. Wrong fucking answer. Choice D, actually real quick, and if you see the bleed for subarachnoid hemorrhage, worst headache of one's life, of course, the bleed looks like a starfish, quote unquote. That's how I describe it. A sand dollar or a starfish. I'm going to link my neuro PDFs below, the neuroanatomy as well as the neuro PDF, and there's images in there. As I already said, wrong fucking answer. Choice D, superior sagittal sinus, wrong fucking answer. So this is actually venous, and this is going to have the tributaries, the superior cerebral veins, the bridging veins, which will come off of this. Okay, we talk about our dural sinuses. So that'll be for subdural hematoma. It's already harped on. You're going to be your crescent-shaped bleed with no lucid interval. Wrong fucking answer. Choice C, and of course, subdural hematoma. Think about deceleration injuries. Okay, so car accidents, also dementia, so decreased cerebral volume, e.g. Alzheimer's disease, can be shaken baby syndrome, alcoholism as another risk factor. Okay, so whereas for epidural hematoma, it's classically hitting one's temporal region, the terion, but classically the temporal region. But I didn't mention it before because occasionally in NBME questions, especially 2CK level, they can say someone hit the side of his or her head and it's still subdural anyway, so I wouldn't overly index on that detail as necessarily being epidural hematoma. Point is, choice D, wrong fucking answer. Choice E, superficial temporal artery, wrong fucking answer. So, as I just mentioned before, you're going to have the external carotid branch into the superficial temporal as well as the middle meningeal, and so it's not related to our answer choice here. If you're not sure, this could be interesting, very flavorful distractor, huh? Because you know that an epidural hematoma can be caused by an impact at the temporal region, as I just said, but it's fucking wrong. You know the deal. Until you make more content, I feel like my stuff, subscribe my channel. I appreciate your time. That's it.